Hello everyone. So today we'll be discussing a new topic which is knee pain. So knee pain is one of the most common symptoms in orthopedic practice. Okay? It can be due to any reason that we'll discuss. Okay? So first we'll discuss the basic anatomy. This is the quadriceps or the extensor muscle. This is the femoral condyle. This is your articular cartilage. This is MCL or medial collateral ligament, medial meniscus, PCL, ACL, lateral collateral ligament, lateral meniscus, again articular cartilage, and femoral condyle. So, knee pain affects people from young to old. Okay, so we'll discuss the young causes first. So young causes is, what do I mean by that? I mean the causes in the younger age group. The younger age group, most common cause is trauma leading to a fracture or a soft tissue injury. What else? Rickets in children. Okay, any ligamentous issue can involve ACL, PCL, MCL, or LCL. Okay, so ACL, PCL, you need to know the basic that the patient or anybody can have problem going downstairs. Okay, and there is a common symptom of instability or lachak. Okay, so you need to ask this from your patient. MCL or LCL are injured in response to varus or valgus stress force. Okay, what else? Patella. So there is something known as chondromalacia patellae, that is for young individuals. What do you do in this? So this is where the articular cartilage of patella gets reduced. You give high doses of vitamin D, for this treatment. Okay, so I'll come to another topic where I'll discuss vitamin D completely. Okay, so today, now an MCQ question. In SCFE or slipped capital femoral epiphysis, there can be knee pain. It is usually a hip disorder but can present as knee pain. So it is an MCQ. Okay. In the old people, the most common cause is OA or osteoarthritis. Don't worry, I'll do a video of the osteoarthritis as well separately. Then there is rheumatoid arthritis. Okay, now coming to x-rays. This is a skyline view, which is there for patella. So patellofemoral arthritis is through skyline view. Okay, this is called a Rosenberg view. Rosenberg view is for your intercondylar notch. See how beautifully the intercondylar notch is there. So any fractures or any trauma in the intercondylar notch, Rosenberg view is to be done. Okay, now coming on to AP and lateral views. They can also be done. They are basic. I discussed in my previous video that there is knee AP and lateral views which can tell you about the osteoarthritis. Okay, so there is this concept called Blumensatt line. Blumensatt line is related to intercondylar notch. Okay, just the name is important, rest you can go on to see. Okay, so in examination, what is to be known? Examination, So basic examination is inspection, palpation, movements. Okay, so inspectory findings like redness, swelling, visible scars, etc. Palpatory findings, tenderness. And tenderness, let me tell you dear, it is something you watch, or the wince of pain. That is tenderness. Okay, and this is not something you elicit. Okay, then there is movements, as we told, flexion, extension, 140 degree, 0 degree. This is the basic examination. What else can you do in cases of swellings? In case of swellings, you can do a patellar tap, where you tap the patella to look for effusion. If there is effusion, you go for knee aspiration. Knee aspiration, which is a modality to reduce or to remove the excessive fluid that is inside the knee joint. Okay, which is followed by an RJ bandage or a Robert Jones bandage. Okay, for a week. I'll discuss later on. Now, what all investigations you will do? As I said, the basic one is an X-ray. Okay, we already discussed it. Then again, a USG or an ultrasound. Ultrasound to assess for effusion. If you're not sure about your patellar tap, then you can get an ultrasound to look for collection in the suprapatellar recess. Okay, then CT scan in cases of fractures. So tell me now, CT scan is for bone, MRI is for soft tissues. Okay, so in order to assess any intra-articular fractures, you assess CT scan. For sports injuries or ligamentous injuries, you do something known as an MRI. Okay, and then another one is called diagnostic arthroscopy. Coming on to the treatment. So treatment for any acute trauma or anything is RICE. What is RICE? Rest, ice, compression, elevation. Okay, then there is something known as PRICE, protect and RICE. Okay, so this is what you can do. Then you can go for a operative intervention according to the trauma or injury or anything. Then there are something known as braces. Example, long knee brace, hinged knee brace, ROM brace, PVC brace. Okay, so this is all about knee pain. Let me know if you have any problem. I'll discuss it further later on. Thank you. Bye bye.